Well, did you know the oldest operating rural hospital in the state is right here in Texoma? As we continue honoring our healthcare heroes, I'll take you to Olney Hamilton Hospital, where the healthcare system is thriving and has been for 115 years.
KFDX 3, celebrating our healthcare heroes.
Dr. Chantel Taylor is a long way from home, hailing from New Jersey.
It's not that I don't like cities or don't like the country, but the medicine that I want to practice is out here. We actually moved my parents here, so they live down the street from the hospital, and I'm engaged now to a local guy, so I'm an Olneyite now.
The family physician chose to practice rural health care in Olney because she knows the impact.
I love that it's family. I know we call it family medicine, but you don't necessarily feel that in other places. But here, I mean, the community, you're living in it, you're taking care of people that are coming from an hour away, and they're appreciative, and it's a nice, warm feeling to be here.
Olney Hamilton Hospital CEO Michael Huff says there's really nothing like what they've got going on there in Young County.
They are here for a reason. Patient care is always at the top of their list, and we have a very low turnover rate. People come here and they stay. They like working here. We have basically 20% of our employees drive past another hospital to come to work here.
The list is long as for what Olney Hamilton has to offer, but there's no shortage of dedicated staff and caring nurses like Samantha Webb. She can't help but brag on her staff and the services people travel from big cities to use.
We're one of the very few critical access hospitals that still deliver babies. The next hospital is 45 minutes away for those moms to have that delivery. So we also offer a swing bed program, and we take care of wound patients as well. We have a very good wound clinic. Our goal is to keep our patients here local in the community where they don't have to drive to other places to get their care.
We do over 800 procedures a year, and we get referrals from all over the state to come here to get pain management services.
Webb is proud, too, to work in the place she's always called home.
One thing I feel like in our small facility is we give that personal touch. You're not just another number or another person. We probably know you, we know your family, we know your kids, we know what's going on.
Right across the street from the hospital, you'll find Olney's new state-of-the-art EMS station. This new facility has everything from dorms to a huge living space and a conference room where training is the name of the game.
We're spoiled. There are not many rural services that have this quality of station. We feel like they're behind us 100%. And so you always want to work harder for people that work hard for you. And, you know, this community is a prime example of that. The hospital is a prime example of that.
Thomas Wright says his ambulances run because the community needs them to.
The state of Texas doesn't have a law that requires EMS. Society pretty much requires EMS. And our rural facilities rely on us for a lot of things. The citizens rely on EMS pretty much as their first contact for health care, especially in an emergency.
And then right next door, the Family Clinic and Rehab Center. Family nurse practitioner Megan Hammond says here they're treating their own.
We get to see, you know, moms, dads, brothers, sisters, aunts, uncles, grandma, grandpas, the whole family. So that's one of the things I like about it the most.
I feel like people assume that we're just a small hospital. We don't have the big facilities like places in a city, but that's the point. We're here because if we weren't, there would be nothing.
I call it the three-legged stool. You have to have good churches, you have to have good schools, and you have to have good health care. And if you have those things, your community will thrive and survive.
Huff says Olney has all three, and they're pleased to be one of the legs that keeps this community standing. Now, Huff says Olney is one of the few rural hospitals in the state, maybe the nation, that's received 3 national quality awards, most recently becoming one of the top 100 critical access hospitals in the entire nation. What an accomplishment.